पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू। Wow.
Today, India will hold a mock drill to check how well prepared our health infrastructure is to control, if at all, there is a COVID surge in the country. Remember, after the sort of unprecedented COVID surge in China, India is also on high alert, and health ministers of all states will participate in this mock drill today to check whether our health infrastructure is ready, if at all a surge hits us. Now, Union Health Minister Mansukh Mandavia will also visit Delhi's Safdarjung Hospital at 9:45 a.m. to oversee this very mock drill.
The mock drills will focus on the availability of health facilities in all districts, the capacity of isolated beds that are needed in isolation, oxygen-supported beds, as well as intensive care unit beds and ventilator-supported beds, along with human resources as well. And to get more on this, we have Vedant joining us. Vedant, this mock drill that's going to take place, take us through, the aspects that they'll be covering besides the facilities that are going to be available at the hospital, especially in the isolation facilities.
That's right, Divya. So remember, the Health Ministry had issued a 6-point advisory to states, and of course it has directed states to conduct mock drills across health facilities. So of course, government hospitals, private hospitals, COVID care centres, mock drills have to be conducted across healthcare facilities. And here in the national capital also, the government-run hospitals will be conducting mock drills. Remember, various aspects will be covered. The primary among them is to ensure adequate availability of beds, making sure that there's an uninterrupted oxygen supply. That is something that the government has been focusing on. So liquid medical oxygen, oxygen cylinders, backup of oxygen plants, all of that has to be maintained by hospital, and inventory has to be maintained. And as far as today's drills are concerned, the hospitals are also likely to consider a major factor is that whether an onboarding of healthcare workers is required or not, because that is something that the centre has directed states to do, to assess if there are adequate number of healthcare workers, frontline workers, nurses, etc. So that is something that will be done by hospitals today. As you rightly mentioned, Union Health Minister Mansukh Mandavia will be visiting Delhi's Safdarjung Hospital. In fact, state health ministers will also be making visits to government hospitals in their respective states. Remember, these are going to be held across states and union territories. Another important aspect to be considered is going to be the inventory of emergency medicines and general drugs. Now, that is something that the central government has directed states to do, to maintain a list of antibiotics, COVID-related medicines, life-saving equipment like SpO2, BiPAPs, ventilators. So an inventory of all of that has to be maintained, and that is something that the hospitals are going to do today. Other than that, the hospitals are also likely to assess the situation as to how they are going to handle if a special case comes up. For example, if a pregnant woman with COVID comes, then what are the possible solutions that a hospital will be providing? How are healthcare workers going to be handling that particular case? So special cases are also something that hospitals are going to look at today. Remember, these drills are going to be held from 9 a.m. to approximately 3 to 4 p.m. In the evening, and Union Health Minister will be visiting Delhi Safdarjung Hospital.